It's October. It is, though, a very important month when it comes to Breast Cancer Awareness Month. And so one area hospital wants you to know about, there is technology out there, ladies, that could help save your life when it comes to dense breasts and technology that is used specifically for that. Dr. Deborah Pat is here with Seton Breast Cancer Care Center. Thank you so much for being here.
Thanks, Sally, for having me.
It is our pleasure. Okay, talk to us about this technology that is specifically designed to help with this certain kind of issue.
Well, the problem is that breasts are frequently dense, and in standard mammography, frequently the sensitivity is low.
Okay.
So if you think about in a dense breast, it's like looking through a clear glass of water, but instead of being clear water, it's a chocolate milkshake. So it's hard to see that black marble or the mass inside. We have 3D mammography, which allows an increased sensitivity, so it's about 40% more sensitive to detect occult breast cancer. And so that's one way in which you can help screening to be more sensitive to make sure you can detect occult breast cancer is 3D mammography. There are other ways too, like MRI, but particularly in young women, this is a common problem.
Okay, and young women, we're talking about what age should we be concerned in getting something like this screened or checked out? What age is the target group here?
It's a great question, Sally. So I should say that all adult women should be doing self-exam every month. Women between 40 and 45 should consider annual screening mammography. Between 45 and 54 should be getting annual mammography without question.
Okay.
And after that, more women can either continue annually or an every other year schedule.
What are you seeing with this new technology that you have over in Seton? Are you seeing that you're able to detect it earlier, and then that in turn gives you a better chance at beating this?
It's a great question, Sally. So the reason to screen and to know your risk from genetic history and to do self-exam is because when you detect breast cancer early, it's more likely to be curable. You're less likely to require aggressive treatments like chemotherapy, more aggressive surgical intervention, and so you're likely to require less difficulties in your life and still attain a cure. Once breast cancer is more advanced or even spread to other organs, it's much more difficult to cure and requires a lot more invasive procedures.
And so one thing you mentioned is how there is genetic testing when it comes to something like this.
Right.
Talk to us a little bit about this, because I know that we've heard it before in the news, but I just want to know, where are we right now in the stage as far as how accessible is this to women?
It's highly accessible, and it's actually changed quite a bit in the last few years.
Okay.
And so it's important for women to understand if they have breast or ovarian cancer or colon cancer or other cancers in their family, and talk to their doctor about it, because unlike 10 years ago when it may be $4,000 to undergo standard testing, now a woman can get testing even if her insurance didn't cover it for under $400.
Oh, wow.
And sometimes even far less if they just test for certain mutations depending upon their risk. And so it's important that people understand their risk, because some women are at very high risk for breast cancer, and I would say the majority of those women in this country do not know it.
Okay, so something like that is available. You have this new technology at Seton that's available, but I think maybe the number one thing that women can do right now is make sure that they have their monthly own self-examination.
Their self-exam, make sure they're following screening guidelines with regards to mammography, and make sure they're talking to their family about their cancer risk.
Okay, Doctor, I appreciate you coming in.
My pleasure.
We'll see you back here maybe next time talking about all the advances in technology and all the lives that you're saving over in Seton.
Thank you, Sally.
Thank you for your help.